you drink first thing in the morning either helps your kidneys do their job or makes them work overtime. After nearly 30 years as a nephrology nurse, I have seen what ends up happening to people who get this wrong for decades. The internet is full of videos promising drinks that flush toxins, and most of them are made by people who have never taken care of a single kidney patient in their life. So let me give you the real list. 5 morning drinks that actually support your kidneys, one that surprises almost everybody. And I'll also tell you about the popular healthy drink I would never hand to one of my patients. If this is helpful, give me a quick like so I know to keep making videos like this. Here we go. Okay, first up, we've got plain water. And I know what you're thinking. Come on, water's not a real tip. But hear me out. And before I get into why, what I'm about to walk through applies to most people without advanced kidney disease. Okay, back to water. Trust me, the truth is most people are walking around low-grade dehydrated every single morning without realizing it. You go 7 or 8 hours overnight without a single sip, and your kidneys spend that whole time working with less fluid than they need. Water first thing in the morning helps reverse that, and it helps prevent your urine from becoming overly concentrated. And concentrated urine is one of the biggest drivers behind kidney stones. So a full glass of water before your coffee, before anything else, is generally one of the simplest things you can do for your kidneys if that applies to you. Next is going to be lemon water. And this one actually has a real specific mechanism behind it, not just a vague detox claim. Lemon contains citrate, and citrate can bind to the calcium in your urine and help inhibit the formation of calcium oxalate stones, which are the most common types of kidney stones out there. So squeezing fresh lemon into a glass of water in the morning isn't just a wellness trend. It's actually one of the few morning drink habits with real stone prevention science behind it. A couple of quick notes. You want this unsweetened because added sugar cancels out a lot of the benefit and just adds empty calories. And it does not need to be warm to work. Warm lemon water is fine, is pleasant, but don't let anyone tell you that warm water has some special medical property that cold water doesn't. The citrate is doing the work here, not the temperature. All right, the next one on this list is unsweetened green tea. Green tea is loaded with polyphenols and catechins. And while I'm not going to sit here and tell you green tea treats kidney inflammation, because it doesn't, there's a bigger picture reason it belongs on this list. Blood pressure and blood sugar are two of the biggest drivers of kidney damage over time. And green tea in moderate amounts has some potential cardiovascular and metabolic benefits that support both of those. So this is less about the kidney directly and more about protecting the systems that protect your kidney. Keep it unsweetened, keep it moderate, and don't buy into anyone selling you a green tea kidney cleanse. That's not what this is. This is a supportive, everyday habit, not a treatment. And by the way, if you're looking at kidney lab results and you're not quite sure what those numbers mean, I created a free kidney lab companion guide that walks you through some of the most common kidney labs in plain English. I'll leave the link in the description below. Now, this next one is probably the one you didn't expect on this list, and it's the one I get the most questions about: coffee. For years, people have assumed coffee is bad for your kidneys, or at the best, neutral. But observational research has actually associated moderate coffee consumption with a lower risk of chronic kidney disease. I want to be honest with you. That's an association, is not a guarantee. And it doesn't mean coffee is treating anything, but it does mean the coffee secretly destroying your kidneys narrative you see online is not accurate for most people drinking it in moderation. Here's the part that actually matters more though. Coffee does not have to be black to be kidney friendly. What matters is what you're putting into it. If your coffee is really a vehicle for a large amount of added sugar, flavored syrup, and heavy cream, every single morning, that changes the nutritional profile completely. And that's where I start to worry, especially for people managing blood sugar or blood pressure. So it's not really about the coffee, it's about what's riding along with the coffee into your cup. Drop a comment below and let me know which one of these drinks surprised you the most. I read every comment and I might make a follow-up video going deeper on the ones people ask about most. All right, last one on this list, and this is unsweetened cranberry juice. Now, I want to be really specific about what this is and what it isn't, because this one gets misunderstood constantly. Cranberry's real benefit is around urinary tract health. Cranberry contains compounds called PACs or PACs, and those PACs can reduce how well bacteria stick to the walls of your urinary tract. There's real evidence supporting cranberry products for reducing recurrent UTIs in some population. And since urinary tract infections that go untreated can eventually put stress on the kidneys, that connection matters. One honest caveat here. Juice is not always the most reliable way to get a meaningful dose of those packs because the concentration varies a lot bottle to bottle. And older research actually questioned whether juice alone did much at all. More recent, larger reviews have found juice, tablets, and capsules all reduce UTIs in people who get them recurrently, without one form clearly beating the others. So juice is a reasonable choice. It's just not automatically the strongest one. If you're someone that deals with frequent UTIs, a standardized cranberry capsule with a label PAC content is worth asking your provider about alongside or instead of the juice. But here's the part I need you to actually hear regardless of which form you choose. Cranberry does not treat an active UTI. If you already have symptoms, burning, urgency, pain, that's a call your provider situation, not a drink more cranberry juice situation. Use this as prevention, not treatment. And if you are drinking the juice, look for low or no sugar added. A lot of the cranberry juice on the grocery store shelves is basically sugar water with a little bit of cranberry in it. And that defeats the purpose. Now, before I wrap this up, I told you at the start, there's one popular healthy drink out there that I would never hand to one of my patients. And I want to make good on that. It's coconut water. I know. It's marked everywhere as natural hydration, natural electrolytes, better than sports drinks. And for someone with completely normal kidney function is generally fine in moderation. But coconut water is naturally very high in potassium. And if you have reduced kidney function, your kidneys aren't clearing potassium the way they used to. Too much potassium building up in your blood can actually affect your heart rhythm, and that's not a small thing. I have seen patients get into real trouble because they were drinking coconut water every day, thinking they were doing something good for themselves, when it was actually working against them. So this one isn't on the list, and if you have any degree of kidney disease, it's worth checking your labs and talking to your care team before you make it a daily habit. So that's the list: water, lemon water, unsweetened green tea, coffee taken the right way, and unsweetened cranberry juice. None of these are magic and none of them replace actual medical care if you're managing kidney disease. But used consistently, they generally support hydration, stone prevention, urinary health, and the cardiovascular and metabolic factors that protect your kidneys over time. And if you want to go even further with this, I actually made a video called What Happens to Your Kidneys When You Quit Sugar for 30 Days, where I walk you through exactly what changes when you cut sugar out for a month. You can check that out right here. I'll see you there.